Welcome to the Cozy Corner. Today I want to address COVID and the increased risk for people who have underlying medical conditions. Adults of any age with certain medical conditions are at increased risk for severe illness from COVID disease. Severe illness is defined as hospitalization, which is 6 times higher, admission to ICU, intubation or mechanical ventilation, or death, which is 12 times higher. Adults from the following conditions are at increased risk: cancer, chronic kidney disease, COPD, Down syndrome, heart conditions including heart failure, coronary artery disease, and cardiomyopathy, obesity, pregnancy, sickle cell disease, smoking, and type 2 diabetes. COVID is a new disease. Data is limited, but adults with the following diseases may be at risk for severe illness from COVID: asthma, cerebrovascular disease, cystic fibrosis, hypertension or high blood pressure, immunosuppressed states such as those produced with steroids, HIV, or blood and bone marrow transplants, dementia, liver disease, overweight, pulmonary fibrosis, thalassemia, which is a blood disorder, and type 1 diabetes. Children with underlying medical conditions are at increased risk for severe disease. Also, we do not know who is at increased risk for developing the new, rare, serious complication of COVID called multisystem inflammatory syndrome, nor do we know what causes it. Reducing your risk of getting COVID-19 is especially important for people of increased risk. The best way to protect yourself and reduce the spread of COVID is to, number 1, limit interactions with other people, and number 2, take precautions when you do interact with people. If you feel sick, contact your healthcare provider within 24 hours. And if you don't have a doctor, contact Community Health. There is no way to ensure you will have zero risk, so you should understand the risks and be as safe as possible. Everyone should take steps to prevent getting and spreading COVID-19. In general, the more people you interact with, the more closely you interact with them, and the longer you interact with them, the higher the risks of getting and spreading COVID-19. Keep these items with you: masks, tissues, and sanitary wipes, and avoid others not wearing masks. Ask others around you to wear a mask, and proper hand washing is also important. It is particularly important to receive recommended vaccinations against flu and pneumonia. Maintain your preventive services like cancer screenings. Stay particularly active and practice healthy habits to cope with stress. Know when to go to the emergency room. Do not delay seeking treatment. If you have underlying medical conditions, follow your treatment plan. Number 1, continue your medications. Number 2, have at least a 30-day supply of prescription and non-prescription medicines. Number 3, do not delay getting emergency care for your underlying condition. Number 4, call your doctor if you have concerns about your underlying conditions or if you get sick and think you may have COVID. Dial 911 in an emergency. And number 5, if you don't have a doctor, contact Community Health. Thank you again for your attention, and stay safe until we meet again.